Hi, I'm Dr. Adrienne Matheson, Child Psychologist. Today I'm going to talk about trauma. What is trauma anyways? Trauma is when a child has an experience that is dangerous or unfamiliar or scary for them, and the brain remembering all of that information that was around them when this event occurred. What the brain then does is stores this information to prepare you for the next time that you're in a similar dangerous situation. What happens with trauma, though, and what leads to post-traumatic stress symptoms is that sometimes the brain can trick the body into these stress responses, or sometimes anxiety, when danger is actually nowhere to be found. So this could be a sound that was present during the traumatic event. It could be a smell. It could be a person. It could be a place that sends the child into a stress response. That could be anxious. It could also be anger. It could be confusion. It could be retreat. There are many different ways that children may respond to this trigger in the environment. What ends up happening is it's very confusing and sometimes frustrating for children to feel this way, and they're not sure why they're feeling this way. There's danger nowhere around them, so why are they feeling anxious or scared? Likewise, for the parents, it can be very frustrating when you have a child who didn't have any trouble going to school or going to a friend's house for a sleepover, and all of a sudden they are unable to do these tasks that they really enjoyed before. Trauma can be something that's really obvious, like an accident or an event that we all understand to be traumatic. We know where the symptoms came from. We can make sense of it. Trauma can also be something that's seemingly insignificant, and we're not even really aware of where the brain got tripped up with this information and why it's storing that information and sending these kids into these stress symptoms. It doesn't really matter where it's coming from. What's important to know is that we can help the brain re-remember these events so that we're not stuck and feeling the anxiety or frustration when we have these triggers in our environment. A common way to treat post-traumatic stress symptoms is through EMDR. This is something that I will often use with children. EMDR essentially helps kids re-remember the event and helps them identify the feelings that were associated with that event and move through the experience so that as they encounter these triggers in their environment in the future, their brain isn't sending the message to their body that it's scary and we need to do something about it, and their heart doesn't get elevated or they don't react to it. In essence, the trauma is no longer impacting them. If you feel that your child is experiencing these symptoms, or you're aware of a trauma that they have experienced and you're concerned that this information is causing them some problems in their daily functioning, please seek support from somebody in your community. There's lots of ways to support these children and help them move through these tricky feelings. Thank you for watching, and we'll see you soon.